There are four specific features that are common throughout all personality disorders. They are distorted thinking patterns, problematic emotional responses, over or under regulated impulse control, and interpersonal difficulties. These four core features are common to all personality disorders. Before a diagnosis is made, a person must demonstrate significant and enduring difficulties in at least two of these four areas. Furthermore, personality disorders are not usually diagnosed in children because of the requirement that the personality disorders represent enduring problems across time. The four key features combine in various ways to form 10 specific personality disorders identified in DSM 5. In order to be diagnosed with a specific personality disorder, a person must meet the minimum number of criteria established for that disorder. Furthermore, to meet the diagnostic requirements for a psychiatric disorder, the symptoms must cause functional impairment and/or subjective distress. This means symptoms are distressing to the person with the disorder and/or the symptoms make it difficult for them to function well in society. There are three clusters in the DSM-5 that are recognized to hold 10 personality disorders. They are Cluster A, Cluster B, and Cluster C. Oftentimes, a person can be diagnosed with more than just one personality disorder. Research has shown that there's a tendency for a personality disorder within the same cluster to co-occur. Cluster A includes the odd eccentric cluster, which includes schizotypal, paranoid, and schizoid personality disorders. Disorders in this cluster are characterized by odd eccentric behavior, antisocial, and have social awkwardness and social withdrawal. These disorders are dominated by distorted thinking and cause patients to not be able to communicate with their family and friends and often become loners and withdraw from society. Cluster B is known as the dramatic emotional erratic cluster and includes borderline personality disorder, narcissistic personality disorder, histrionic personality disorder, and antisocial personality disorder. Disorders in this cluster share problems with impulse control and emotional regulation. Cluster C is the anxious, fearful cluster and includes avoidant, dependent, and obsessive compulsive personality disorders. One of the most common in the world is OCD, or obsessive compulsive disorder. These three personality disorders share a high level of anxiety and fearfulness of objects or germs or many things, including people and friends and family members. The DSM-5 method for diagnosing personality disorders is called categorical approach. However, an alternative method called dimensional approach is also presented in the DSM-5. These two methods are the only known ways of diagnosing personality disorders, and the most common uses of treatment are therapy or medication.